So I want to talk about an oft ignored stabilizer in the shoulder joint, and that is the subclavius muscle. So my name's Beth, and I'm with Cantata Wellness. And today on Technique Tuesday, we're going to talk about some techniques to work with that subclavius muscle. So to find subclavius, you want to find the clavicle, and then you also want to find that angle of the sternum. So the manubrium is here, and then where the body starts, that's the sternal angle. And that should be where rib number 2 is. Subclavius comes from rib number 1 and then goes to the inferior surface of the clavicle. So it's right along here where my finger is. Um, to work that muscle, which often gets tight if somebody's had a shoulder injury or if somebody's had a lot of respiratory conditions and discomfort, you can find tension here in this muscle. Now you can work it from the head. So if you're at the end of the table, and bring your fingers under, but for camera purposes, I'm kind of going from this angle. So I want to put some gentle pressure along the inferior part of the clavicle, and I'm going to push from the sternum out towards the acromion. Now I don't have to go real far. This is not a big chunky muscle. So I'm going to work in like this, and like I said, I'm going to work all the way from the sternum over to the clavicle. Now, you can use your thumb if you feel strong enough. You can always do this across the body. I'm going to get up and walk to the other side and show you across the body. And with that, you'd maybe stack your fingers. Tension in the subclavius can be uncomfortable for our clients. Sometimes when they're taking deep breaths, it'll feel uncomfortable, it'll feel tight right along the rib cage and the base of their neck. And so I want you to think about subclavius next time you've got a client with a shoulder injury or somebody who's been in respiratory dysfunction. Again, my name is Beth. It's Technique Tuesday. I look forward to seeing you next week.